Today in this video, I'm going to talk about different types of ST elevation myocardial infarctions. So let's start the video. The first EKG strip that you can see here is showing gross ST segment elevation in our septal and anterior leads. These are V1 and V2, V3 and V4. And this area of the heart is supplied by left anterior descending artery. So there is a complete occlusion of this artery that would result in ST segment elevation in these four leads. Now you can also see there are reciprocal changings in leads 2 and 3. The reciprocal ST segment depressions happen in diagonally opposite leads. And we also have to keep in mind the criteria for ST segment elevations for them to be significant is that at least one small box ST segment elevation should be present in all leads except for lead V2 and V3, in which ST segment elevation should be at least 2 small boxes in males and 1.5 small box in females. The second EKG strip is of lateral wall myocardial infarction. You can see the ST segment elevation that has been highlighted by green color, and you can also see there are reciprocal ST segment depressions in diagonally opposite leads that have been highlighted by the orange color. Now the lateral area of the heart is supplied by left circumflex artery, and if there is occlusion of that artery, there would be ST segment elevations in leads 1, AVL, V5 and V6. Now this is probably the highest yield EKG strip of this whole video. The green color is showing ST segment elevations in leads 2, 3, AVF, and we know very well this is our inferior wall myocardial infarction. And leads 1 and AVL are showing reciprocal ST segment depressions. But what you are seeing in leads V1, V2, V3 and V4, this is not a reciprocal change. You can see there is ST segment depression, but it is with prominent R waves. So whenever there is ST segment depression in leads V1, V2, V3, V4 with prominent R waves, this is always going to be posterior wall myocardial infarction. So this is inferior and posterior wall myocardial infarction.